Good morning, everyone. Bonjour tout le monde. Yesterday, I shared with you that my wife Sophie was being tested for COVID-19, and that test did come back positive. Sophie's symptoms remain mild, but we are following medical advice and taking every precaution. She will remain in isolation for the time being. We are thinking about all the families across the country who've received the same diagnosis. But we're in good hands. We have full confidence in Canada's health officials and professionals. This means that, upon my doctor's recommendation, I will remain in self-isolation for 14 days. I want to be clear, I have no symptoms, and I'm feeling good. And technology allows me to work from home. Of course, it's an inconvenience and somewhat frustrating. We are all social beings, after all. But we have to do this, because we have to protect our neighbors and our friends, especially our more vulnerable seniors and people with pre-existing conditions. We are following medical advice, as should all Canadians. And on that note, I want to thank all of Canada's health professionals and the Public Health Agency who are doing an incredible job supporting and looking after all of us. Hier, je vous ai informé que mon épouse Sophie avait subi un test pour la COVID-19 et le test s'est avéré positif.
The symptoms for her are very low or very weak, and we are following medical advice and taking all possible precautions. She will therefore remain in self-isolation for an indeterminate period. We are thinking as well about Canadians across the country who received the same diagnosis. We are in good hands, and we have full confidence in healthcare professionals and healthcare officials here in Canada. That means that following the recommendation of my own physician, I will be in self-isolation for 14 days. I want to be clear, I have no symptoms, I feel very well, and I'm working from home out of precaution. Technology now allows us to work at home, and of course it's not ideal and somewhat frustrating, but after all, we are all social beings. And it's something that we must do in order to protect our friends and neighbors, particularly the most vulnerable people and people who have underlying medical conditions. We are following medical advice like all Canadians should be doing right now. I want to take this opportunity to thank all healthcare professionals and the Public Health Agency of Canada, which is doing exemplary work. I now want to tell you what Canada will be doing to ensure your safety and security and protect your health. Yesterday, I had a discussion with a number of international leaders, including President Trump of the United States, Prime Minister Johnson, and Prime Minister Conte in Italy. I also took part in the meeting of the Special Cabinet Committee meeting on COVID-19, and I had telephone conversations with finance ministers with respect to the current economic situation. I had an opportunity to talk to the CEO of the Chamber of Commerce and the President of the CLC. This morning I had a cabinet meeting and I spoke to President Macron of France. Those discussions will be continuing in the coming days. Earlier today, Minister Blair's Haidu did announce that we are recommending that Canadians avoid all non-essential travel outside the country. We also announced that the cruise ship season will be suspended until July and that we will be tightening control measures at airports. We will also be looking to better control international passengers arriving in Canada.
Announced that Canada has advised Canadians to curtail non-essential international travel and that the cruise season is suspended until July and that we are bringing in additional screening measures at airports. We are also streamlining overseas arrivals to be better positioned for screening. Yesterday, we saw many provinces take strong steps to keep people safe. They are doing what needs to be done to protect the public, and I want to thank them for their exemplary work. Later today, I will have a call with the premiers and Indigenous leaders to discuss the latest developments and coordinate our efforts, including the over $1 billion COVID-19 response fund, which provides money to the provinces and territories to support preparation and mitigation. These are significant steps, and we will do more. The provinces and territories are facing various levels of risk, but we will make sure that we align our response across the country. Addressing COVID-19 must be a Team Canada effort. To keep Canadians safe, to mitigate the economic impacts of the virus, all levels of government are working together. We are talking regularly. We are coordinating our efforts. We're following the situation very closely, and we're pulling out all the stops. I know that you're worried. You're worried about your health, about your family's health, about your job, your savings, about paying rent, about the kids not being in school. I know that you're concerned about uncertainty in the global economy. The steps being taken to keep you safe have an economic impact. But what is also true is that we are in the enviable position of having significant fiscal firepower available to support you. This is in addition to the measures we've already taken. The Finance Minister is also in constant communication with his international counterparts to find ways to work together to mitigate the impacts of the virus on the global economy. He will have further announcements shortly this afternoon. The agreement we reached with other parties to suspend the House today also still gives us the flexibility to do the things we need to do in order to support Canadians. No one should have to worry about paying rent, buying groceries, or additional childcare because of COVID-19. We will help Canadians financially. The Government of Canada will be introducing a significant fiscal stimulus package in the days ahead. Le gouvernement du Canada annoncera des mesures de relance fiscale.
Announcing a significant fiscal stimulation package in the coming days. I know there are many of you who are worried for your health and the health of your families. We are doing everything we must do to protect our economy, and we are in a very advantageous fiscal position. All orders of government are working together to stop the spread of the virus. Businesses and citizens like you are all taking precautions. Here in Canada, we have healthcare professionals who are incredible and who are doing an incredible job.
Is working to stop the spread of the virus. Businesses and citizens are taking precautions. We have outstanding public health authorities who are doing an outstanding job. We will get through this together. Merci tout le monde.
Bonjour, Monsieur Trudeau. Louis Blouin de Radio-Canada. Vous avez évoqué des mesures.
You talked about measures to limit the number of foreign travelers coming into Canada. Could you be more specific? What exactly are you thinking of? Do you mean the number of flights? Will you be targeting specific countries? People are concerned that this may happen to them if they're coming in from another country. What exactly are you going to be doing? We are working on the specific measures, but I can tell you that we will be reducing the number of airports that will be bringing in international passengers in order to better streamline those passengers and assess them to ensure the safety of Canadians. We are also looking at the origins of flights and travel to determine whether other steps are required, and we will be working every single day to ensure that Canadians are safe.
We are looking to reduce the number of airports that will accept travelers from overseas in order to be able to give the proper resources on all arrivals to ensure that we're doing everything we can to keep Canadians and Canada safe. We're also obviously looking at countries of origin and further measures that we can take. We will make those decisions based on the best science, the best recommendations of our health officials.
Est-ce que ça fait partie de vos options de fermer?
Is one of the options the possibility of closing the border to certain countries? And if so, what criteria would you apply? Is it the number of cases in Canada or that sort of thing? Well, our assessment criteria for future decisions are entirely based on the recommendations of experts and our healthcare professionals. We have full confidence in authorities here in Canada and around the world, and we will be following their recommendations. We will not be ruling out any possible step. We'll look at what we need to do to continue to do the work we've been doing for weeks now to keep Canadians safe, and that will continue.
We will continue to make decisions based on recommendations of medical experts, public health authorities, and top scientists. We understand that we have taken significant measures over the past weeks and month to ensure that Canadians are kept safe and to slow the spread of the virus. We will continue to make determinations about how best to do that based on recommendations of experts. We're not closing the door to any further steps, but we will make those decisions based on what science tells us.
Ryan Tumulty, National Post, sir. The financial markets have had two of their worst days on record this week. I'm just wondering, you talk about the government's fiscal power. Why haven't we used it yet, and what are you planning to do?
2 days ago, we announced a $1 billion plan to help invest in health and support Canadians across the country. We've also put forward measures that will strengthen EI and help Canadians. We recognize there is much more to do. We do not want any Canadian to have to worry about whether or not they're going to be able to pay their rent, whether or not they're going to be able to buy groceries or care for their kids, or elderly family members. We need to make sure that Canadians have the options and the ability to follow the best public health advice and keep themselves safe. That is what we are focused on, and we will be rolling out those measures in the coming days. The Finance Minister will make further announcements later today on concrete measures to support our economy. But further to that, in my conversations with my fellow G7 leaders, we have agreed that it will be important for us to coordinate at a G7 level to impact the global economy, and we will be continuing to follow up on those conversations in the coming days as well.
Are you considering direct financial payments to Canadians or to affected industries?
We are looking at ways to help Canadians directly, yes. Particularly vulnerable Canadians who are going to be particularly squeezed if they aren't able to go to work. These are the kinds of things we're focused on. We also know that small businesses may struggle through or will struggle through this period of economic slowdown, of people choosing to stay at home and protect their families. We will look at how to support them so that once we get through this difficult time, our economy and Canadians will continue to prosper.
We are looking at how we can provide direct support to Canadians who are in more difficult situations because of not having any paycheck. We know that can have a severe effect on the ability to pay rent or to look after their children or seniors, or to put food on the table. So we will be taking direct steps to support Canadians who are in difficulty, and we will also look to help small and medium-sized businesses that will be facing a number of difficult weeks as we respond to the threat of this virus. We will also be announcing measures this afternoon through the Minister of Finance, and as well in early next week with additional measures to directly help Canadians.
In CBC News, obviously we wish good health to all Canadians, but if you are to fall ill, members of your cabinet, for instance, what is the plan for governing?
We have continued to engage. I've been very busy both yesterday and today. We'll continue to work from home remotely to do the important things that need to be done to keep Canadians safe. We have an exceptional cabinet that is working hard on all these issues as well. We have extraordinary public servants servants who are working as well. We will continue to do the work that needs to be done to keep Canadians safe while following all directions by our public health officials.
I don't think that indicates whether there's a contingency plan in place if you were to fall sick. I'm also curious why public health officials have told you you don't need to be tested.
First of all, there have always been contingency plans for ministers who are sick or have, or even a prime minister who is fallen ill. We will continue to follow all those correct contingency plans. But as I said, for now, I am continuing to work extremely hard from home. In terms of advice I've gotten from medical professionals, it was explained to me that as long as I do not show any symptoms at all, there is no value in having me tested.
I am following the recommendations of public health authorities who have explained to me that as long as I do not have any symptoms of the coronavirus, there is no point in being tested. Yes, but there are Canadians who may be wondering, you're in good shape, we know that, but you may have the coronavirus without having symptoms. Now, you're still sharing the same home as your wife, Sophie. Why will you not be tested systematically every single day? Well, the advice of experts and physicians is that as long as I have no symptoms or I'm not feeling any symptoms, there is no point in testing me. Now, we understand, Ms., that Sophie Trudeau came back last weekend. I know that you met with a lot of people last weekend in Toronto, as well in Ottawa all week. Are you not afraid that you may have been a vector of transmission of the virus? Well, we did discuss that with the public health authorities, and the fact that I have no symptoms and show no symptom whatsoever of the coronavirus means that, according to them, there is no risk for the people I might have worked with over those days.
According to health officials, the fact that I have expressed absolutely no symptoms means that anyone I engaged with throughout this week has not been put at risk.
Marika Walsh with the Globe and Mail. I'm wondering, given the warnings that Canada is now giving about traveling abroad, should Canadians still be traveling between provinces, between cities, given how different the virus is spreading within Canada?
I think people need to make responsible decisions and check with their medical professionals and check their own travel plans in terms of what makes sense for them. I know that Canadians will listen to the advice of experts and make decisions that are appropriate for them and for their family.
And can you describe specifically what your self-isolation means, both for you and your family and your wife? You're outside right now. Is your wife still going outside? Is your family still going outside? What does self-isolation actually mean for your family?
We, as are many Canadians right now, following very carefully the advice that public health professionals are telling us in terms of what we can do and what we shouldn't do.
So what does that mean?
That means I am in isolation, as are my children, and my wife is in quarantine.
Glenn McGregor, CTV News. Prime Minister, in your conversation with President Trump yesterday, was there any discussion about future access of Canadians to cross the U.S. border and should the situation worsen? And also, do you have any concerns, given the U.S. slow response to this, about Americans coming here?
We have been working very closely with our counterparts in the United States to coordinate our efforts at the border and to align our efforts. There is certainly ongoing conversations that will continue to be had as the situation evolves, but I am confident we will continue to be able to work very closely with the Americans to keep people in North America safe, particularly to keep Canadians safe. On that, it is worth noting that it was one piece of good news that comes out of this situation is that the new NAFTA has now been fully passed and ratified and is now awaiting royal assent, which should happen very quickly.
Just following on my colleague's question, could you describe your situation domestically here in a little more detail? Is your wife here in this house? Are all 3 kids here? And if so, question a lot of Canadians are dealing with is how are you going to keep them occupied for the next 2 weeks?
Most of the morning, the kids have been doing Lego, and my wife has been on the phone to friends and family. I have been on the phone with President Macron, with Cabinet, with officials and members of my team as we work to keep Canadians safe.
Good afternoon, Prime Minister. Teresa Wright from the Canadian Press. What is your single biggest concern about Canada's preparedness at this point?
My concern is that Canadians continue to follow the directions of public health authorities. We have to be alert and responsible. We don't want to panic, but we don't want to take this too lightly either. Finding that middle ground is always going to be challenging, but I have tremendous confidence that Canadians are going to be able to.
And what are you telling your children about the heightened sense of concern in the country, and also how are you explaining some of the political decisions that you're making?
We're obviously having some very good conversations with our kids about what's going on, about how not to be overly concerned, but to be a little bit concerned, which is obviously why they are home today with us. We're going to continue to have thoughtful conversations as parents across the country will be having with their kids.
Last question.
Prime Minister, good afternoon. Bruce Campion-Smith, The Star. Just wondering if you'd walk us through the logic that Canada has not taken the step of restricting international travels. Is that we don't agree with perhaps the science in those countries or the experts in those countries that advocate for such a move?
Different countries will have experts that give them advice that is suitable for their own situation. We have followed the instructions and the advice and the recommendations of our top public health officials. We will recall that in a number of weeks ago, in the beginnings, there was discussion of whether or not we should entirely close our borders to China the way the United States did. We did not, and we were able to manage it in a way that allowed for control and a non-spread of the virus that gives us confidence that our public health officials are giving us the right recommendations for Canada.
And on the fiscal stimulus package that's coming out, can you just describe to how will is that in place of the budget? Is this kind of a series what we could expect now through the end of this crisis?
We are obviously focused primarily on how we are going to get money into the pockets of Canadians who will need it because of this situation. We've had many discussions over the past months about the budget. That work will continue, but our focus right now is on ensuring that Canadians have the resources and the money to not have to stress about rent and about groceries and about childcare and elder care at a time where they're also very worried about their health and their family's health. We will be supporting the economy and Canadians through this time. Notre priorité maintenant demeure la santé et le
remains the health and well-being of Canadians. We want to ensure that no Canadian is worried about their ability to pay their rent or feed their children or look after their parents. We will do everything we need to do to help them. And for weeks now and months now, with respect to the budget, well, those discussions are continuing, but right now our priority is to help Canadians that are suffering.